Well, good morning, everybody. Once again, Dr. Salim is here with you guys. Let's discuss some more questions regarding the ARDMS registry examination. Especially, we're talking about the SPI. And let's make our knowledge stronger and let's make it easier for us to pass our ARDMS examination. Okay, so here is the question. The question says approximately how much power or electricity is needed for the creation of one sound pulse. So what do you think? Which one can be the correct answer? Exactly. A is the correct answer. 100 watts. Correct. Okay, next. Ultrasound pulsar will determine which of the following of the waveforms. So what do you think? Which of these will be determined, will be filtered, will be create, will be measure in the ultrasound machine? So which of these? PRP, PRF, amplitude, frequency, or all of the above? Which of they will be created in the pulsar? Correct, all of the above. Okay, next question. What is the relationship between the PRP, pulse repetition period, and PRF, pulse repetition frequency? What do you think? Very simple and easy question. Yes, correct. They have indirect relationship. One increase, the other decrease. Correct, absolutely. Next, with the deeper structure imaging, when you scanning or you're looking for something really deeper in a penetration, what type of PRP does a transducer use? So what type of pulse repetition period they use? Yes, B is the correct answer. The longer one, because it needs a stronger wave to penetrate deeper. Correct. Okay, next question. It is asking for, okay, here it is. Shorter pulses, or we can say a shorter pulse repetition period is achieved with the following frequency transducer. Which type of transducer will create a shorter PRP? So what do you think? Yes, I agree. High frequency transducer, absolutely correct. Longer listening time can be achieved with which of the following frequencies? Like it take longer to receive the listening time. So which of the following transducer will have you to give you a longer listening time to create the picture? Yes, I agree. 3 megahertz because they will use for the deeper structure. That's why. Exactly. Okay. This question, a very simple, easy question. What is a frame rate? What do you think? Like, what is the definition of frame rate? Which one do you call frame rate? Yes, correct. Number one, A is the correct answer. Number of images per second. Now, each machine is different. Some machine will give you more images, some will give you less images. So there is a range of them. So it's different. Correct. Next, what is the normal range of PRF, pulse repetition frequency, for the grayscale imaging? What do you think? Yes, I am also agree. Correct. B is the correct answer. 4 to 15 kilohertz. That's absolutely correct. Okay, now next question. This question is asking that what is the normal range of PRF, pulse repetition frequency, for the Doppler modalities, like pulse wave Doppler, continuous Doppler, color Doppler, all those Doppler studies? Yes, correct. That range is absolutely correct. And that is actually A is the correct. 5 to 30 kilohertz. Okay, next. What is the most used frequency range for imaging sonography? Like, what is the range of most common using frequencies we use it for the imaging, for the picture? So what do you think? Exactly, B is the correct answer. 2 to 20 megahertz. The lower the frequency, the deeper the structure. The higher the frequency, the superficial the structures we're going to use. Here is attenuation is important on that area. Okay, next. It says the component of the receiver that functions on every single signal, which is returning to the machine, is called. So, there is a function which affect on each single signal, they come from the reflection back equally. So which one is that? Yes, amplification. Exactly. It will give the same amount of brightness or darkness to each single pixels. That is correct. Amplification is the correct answer. Okay. Amplification is operator adjustable. Is this true or false? What do you think? Yeah, of course, it is true. Absolutely, that is true. Okay, let's do a few more questions. Okay, here is the question. Which of the following is the correct unit for amplification? Keep in mind, okay, it's amplification. So what do you think? Yeah, of course, it's easy question. And the answer is B, which is positive decibel, not negative, because negative is for the attenuation. That's also a unit, but that's for the attenuation. This is correct. B is the correct answer. Initial intensity should be multiplied how much to get 6 decibel amplification for the initial intensity. So, you know, at the end, the final intensity should be, we can say, multiply with which number to get 6 decibel amplification. What do you think? Yes, that is correct. 4, C is the correct answer. Absolutely correct. Okay, so kind of the same question. Let's say if you have initial intensity multiplied with which number initial frequency should be multiplied to get that 9 decibel amplification. What do you think? Yes, again, C is the correct answer. 8. It has to be multiplied initial with 8, and then you get 9 decibel of the amplification. Correct. Next, initial intensity should be multiplied how much to get the 30 decibel amplification for final? What do you think? Yes, correct. 1000. Now, here is a little bit easy formula. You can look here. After those numbers, when you come to 10, the 0 comes with it. And then after 10, it's a logarithm. So with the logarithm, what we do, that we count the zeros. For example, if you look here in the 1000, there are 3 zeros. So that 1 0 from beginning, it comes after 10. It will just continuously come. And then you look for the numbers of these numbers. How many zeros? Like in 1000, you have 3 zeros. So that's a 30 decibel. If you look to 100, that is actually 20 decibel. If you look to 10,000, in that case, that will be actually 40 decibels. And now if you look to here, 100,000, so it's a 5 zeros, that will be 50 decibels on that case. That is absolutely correct answer. Okay. Now, initial intensity should be multiplied how much to get a 0 decibel amplification for final intensity. Now, like, okay, this is easy question, but let me see, I will explain later, but you tell me. Exactly, it will be 1. Why? Because with the 1, actually, we're looking for that anything multiplied with 1 will get the same number, the original number you will get. So it means that we did not lost anything to gain it back. So in this case, it's 1 because you're talking about no amplification. No amplification means initial times 1 will be back initial. Final and initial are equal now. So that is correct. 1 is the correct answer. Okay, let's do the next one. Okay. So it says, if you want to make your ultrasound picture brighter or darker in a specific area, this is a key point, okay? In a specific area, which of the following knobs or functions you should use? What do you think? So the key point is in a specific area, keep in mind. Correct, TGC, time gain compensation, because normally we have 8 TGCs in all of the scanners or ultrasound machines. And then you just use any of them like a specific area, you make it darker or you make it brighter. You can do that. If you move it to the lateral, it will make it brighter. If you move the TGC to the medial side, and that will give you darkness on that area. Correct, absolutely. Okay, let's do 2 more questions, okay? So now, normally, which area of the image needs to be compensated for time gain the most? Like in a picture, which area needs more TGC, we can say, like more use of TGC. Now let's make it easier. What do you think? I agree. The bottom of the image, because at the bottom of the image, the sound lost the most of its intensity power in amplitude. So we can say most attenuation will happen in the bottom of the picture. So that's why the TGC will be moved to the lateral of that area. It's more neat. Okay, let's do the final question. It says select the correct option of dynamic range for human vision. So how many flicks we can say the human eye can determine about the shades of gray? So what do you think? Yes, that is correct. A is the correct answer, 20 decibel. So the human eye can only detect that flickers of the shades of gray, which is 20 decibel. More than that, it cannot. Okay, my dear listeners, waivers, healthcare providers, once again, please share the channel with all those who need these type of questions for their knowledge, for their practice, for their, if they are trainers, or maybe they are sitting for any of the board, national or international examination. And please let me know how to make it more better. Leave a comment. Thanks a lot. And if you did not subscribe the channel, please subscribe it because you will get the notification for upcoming notes, upcoming questions. Okay, take care and see you next. Take care.